Hey, this is Nurse Ben, back with another topic. Today we will be discussing chest tubes. This topic is very important to know before you take your boards. Let's dive in. Chest tubes. What is the purpose of the chest tubes, and why do we use them? The answer is that chest tubes re-establish the negative pressure in the pleural space. Chest tubes are used to restore normal pressure and remove abnormal substances from the pleural space, allowing the lungs to expand properly. They help to re-establish negative pressure, which is necessary for proper lung function. They are typically inserted during surgical procedures or in emergency situations to treat conditions such as pneumothorax, collapsed lung, hemothorax, blood in the pleural space. In case of pneumothorax, chest tube removes air. In case of hemothorax, chest tube removes blood. And in case of pneumohemothorax, chest tube removes blood and air. Chest tubes are inserted through a small incision in the chest wall, typically in the mid-axillary line, the area along the side of the chest. The tube is then advanced into the pleural space under sterile conditions using a surgical technique. A chest tube is connected to a drainage system that collects and removes the fluid, air, or blood from the pleural space. The system consists of a collection chamber, water seal chamber, and suction control chamber. The collection chamber collects the fluid or air draining from the pleural space. The water seal chamber acts as a one-way valve, allowing air to exit the pleural space during exhalation but preventing air from entering during inhalation. The suction control chamber regulates the amount of suction applied to the chest tube, if necessary. If the drainage system is knocked down, set it back up and tell the patient to take deep breaths. It is not an emergency. If the water seal breaks, it's an emergency. How are we going to respond in this situation? 1. Clamp the tube. 2. Cut it away from the broken device. 3. Submerge in sterilized water. 4. Unclamp because we established the water seal. What if the chest tube is dislodged? Cover it with a gloved hand, and then cover it with the Vaseline gauze. If the question says what you should do first in this situation, then pick the option that says cover with the gloved hand. If the question says, what's the best response in this situation? Then pick the option that says cover with Vaseline gauze. In the water seal, intermittent bubbling is always good. Continuous bubbling means there is a leak, and we need to intervene. In the suction chamber, continuous bubbling is good. Intermittent bubbling is bad, turn suction higher. This is all you need to know about chest tubes. Hope you liked this video. Leave a comment with a topic you want to learn more about. Stay blessed.